Might have to kind of look over to my second monitor once in a while, which is not what I would love to do, but we'll make it work. All right, so we'll go ahead and get started. As I shared, we are developing a new entry-level occupational therapy doctorate program at Keck Graduate Institute. And our motto is that innovators start here. You're going to hear me say that word innovation a lot today. We are really thoughtfully considering how we can develop innovative occupational therapists who are ready to address the future needs of communities, population, society. So if you're not aware, Keck Graduate Institute, and I'll go ahead and just say KGI from here on out, is one of the 7 Claremont colleges located in Claremont, California. That's on kind of the eastern side of Los Angeles County. And there are 5 undergraduate institutions and 5 undergrad institutions and 2 graduate institutions as part of the Claremont Colleges Consortium. KGI is the newest of those 7, but we were established in 1997, so it has been around for a bit now. This is not a fully inclusive list of all of the programs that are offered at KGI, but I just wanted to give you a little bit of a sense of what's going on here. So a couple examples of program offerings are a Master of Science in Medical Device Engineering, Doctor of Pharmacy program, Master of Science in Human Genetics and Genetic Counseling, and a Master of Science in Community Medicine. And this exciting program just started in the past couple of weeks here. It's the first of its kind in the US. It's a fully online program for those interested in potentially pursuing the medical field or an allied health profession. And we're excited about opportunities for a partnership between our program and that one. But it's a time of really exciting growth and expansion at the institution as well. In addition to our occupational therapy doctorate program, there's also a Master of Science in Physician Assistant Studies that will be starting at the same time as our OT program. So in terms of a program overview, like I mentioned, we are really dedicated to preparing scholars and innovators of practice that can meet real-world needs through maximizing health and well-being through daily activity. And as such, our program aims to train future OT practitioners for clinical excellence and foundational skills, but as well as for the future of practice too. Graduates from our program will certainly be well prepared and have all the competencies necessary to go into more traditional settings, but our program strongly emphasizes preparing students for non-traditional or emerging settings as well. And so our grads will have the tools to establish a distinguished career in a wide range of settings. And maybe for those of you who are interested in advancing your career beyond just professional clinical practice, preparing you for roles in leadership and education as well. So on this slide, you'll see our mission, and there's a couple of key pieces highlighted that I definitely want to talk about, but as a whole, through a transformative and dynamic educational process, the mission of KGI's OTD program is to develop innovative occupational therapists who utilize the therapeutic potential of occupation to promote and sustain health, well-being, participation, and inclusion with persons, groups, and populations to meet a wide range of ever-changing real-world needs. So we really believe here at KGI that there is so much potential for occupational therapy to address a wide range of needs that we're seeing in society right now. And so we'll ensure that our program is providing a solid foundation of scholarship of practice and preparing students to be creative problem solvers and develop their professional reasoning skills, utilize evidence and theory to support what they're doing in practice, and in doing so really be the future of the occupational therapy profession. For our vision, our program will prepare practitioners who are leaders and scholars of practice dedicated to providing optimized occupation-based care and translating advances into the profession in a wide range of current and future occupational therapy contexts, as I've already mentioned. Our grads will advance the OT profession in practice, leadership, and academic roles while upholding a steadfast commitment to innovation, cultural responsiveness, and advocacy for the benefit of society. In a little bit, I'm going to be talking about some of our program highlights. And in addition to that innovation piece being a key component, this concept of cultural responsiveness is also really important to us. ensuring that we are being culture responsive at many levels, making sure that this is integrated into our curriculum, also the makeup of our faculty, and looking at how we can bring in a diverse student body to then have a more diverse occupational therapy workforce. So this is our makeup of our program. As a newly developing program, we don't have OT students yet. Our first cohort will start next fall in August of 2022. We are going to have a maximum of 40 students per cohort, and we are only starting one cohort per year. So we'll start every fall. And this was really intentional on our part to keep the class sizes relatively small and to not have too many cohorts, because we wanted to make sure there was a really good faculty to student ratio, not only for course instruction, but also for student advisement and mentorship of research and capstone projects. The program is a little under 3 years. It's 8 total trimesters. So it does go year round, fall, spring, summer through 8 trimesters. And you're looking at 129 total credits, including all of your didactic coursework, some opportunities for electives, which I'll touch on a little bit more later, your fieldwork, and your capstone. And we are aiming to have 10 full-time faculty to support the program. Structure. So as I mentioned, we have those 8 trimesters. The first year has the first 3 trimesters. And what you see here is that there are level 1 fieldworks that go along with each trimester. So there will be another slide describing this in more detail, but it's a very integrated approach in that we want to ensure our students have a level 1 fieldwork that corresponds with the content they've been learning in the classroom that can really translate what they've learned into practice. And we are hopeful that by providing so many level 1 fieldwork opportunities, students will feel all the more prepared when they go out for level 2 fieldwork and capstone. And I'm kind of working under the assumption that you're here tonight, you know a little bit about fieldwork requirements in OT, but I'd be happy to answer any questions about that as well. And then moving into the second year, you'll have your 2 last trimesters of didactic coursework with corresponding level 1 fieldwork opportunities. So that's a total of 5 didactic trimesters. And then at the end of that second year, you'll start your first level 2 fieldwork. That's 12 weeks full time. And then moving into your third year, you'll complete your second level 2 fieldwork. That's another 12 weeks full time. And then move into the doctoral capstone experience, which is 14 weeks full time. Here on this slide, I presented our curricular threads. And curricular threads are just a way for a program to really orient itself around values, around content that we feel is really important for our students to be prepared with. So as we've developed our curriculum, we have woven these threads or these themes throughout each trimester. First is occupation as change agent and healing modality. Regardless of what topic you're learning about in our program, whether you're learning about anatomy, whether you're learning about how to develop programs, whether you're learning about management and leadership, occupation is always going to be at the center of that. We'll be tying everything back to why does this matter for occupational therapy, and really working under the belief that occupation can be a change agent. Second is optimized service delivery based on skilled professional reasoning and evolving theory. We want to ensure that our students feel well prepared to deliver services in a wide range of settings. And in order to do that, they need time in our program to hone their professional reasoning skills. And part of that is being able to apply theories to guide your practice, as well as apply research evidence and scholarship, which I'm kind of jumping down to number 4. I'll get to that in a second. The third is innovations in practice. As I've already stated, we're just looking for ways to ensure that our students are prepared with the most up-to-date, current, cutting-edge approaches and technologies to support their practice. So for research, evidence, and scholarship, what we want to highlight here is that students in our program are not just learning about research, they're learning how to conduct research. We feel that as part of doctoral level education, it's really important that students understand the necessary components that go into developing and carrying out a research study to contribute to the OT body of knowledge. So over the course of 3 trimesters, students will work together in small groups under faculty mentorship to carry out an entire research study and present those findings. In addition, the Capstone experience allows for an additional opportunity to develop those scholarly skills. The fifth is lifestyle medicine for whole person care. I'm going to talk a little bit more in depth about that when we discuss distinguishing features of our program. Again, the cultural responsiveness that I mentioned earlier. And then lastly, professional identity, leadership, and lifelong learning. So we really want to be providing a multitude of supports to help students develop as professionals and prepare them for a career, and also just emphasize, we are very excited about the curriculum that we are developing, but there's no way we can possibly teach everything there is to know in 3 years, and there's always new things coming out in practice, right? So we really want to develop this idea of being lifelong learners and equipping students with the skills to advance their learning even long after graduation. On the screen, you'll see our program learning outcomes. In essence, we're saying that when students complete our program upon graduation, this is what they will be leaving our program with. So you'll be able to provide client-centered care with occupation as a primary therapeutic agent. You'll be able to demonstrate professional reasoning based in evidence, theory, process, and interprofessional collaboration to achieve optimized therapeutic outcomes. Enact the skills of professionalism, communication, compassion, ethics, and lifelong learning as foundations for professional identity and therapeutic use of self. You'll be able to analyze and conduct research to advance the profession and develop as a scholar of practice. You'll implement and advocate for health management and promotion services to address society's current and future occupational needs. Act with cultural responsiveness to provide optimal care and to address systemic and occupational injustices for persons, communities, and populations by advocating for equitable access and inclusion. And serve as leaders to advance the occupational therapy profession through innovation, inquiry, and advocacy. And Lexie, please let me know if there's any questions popping up in the chat, since I'm not able to see that right now. Here, we've outlined some of our curriculum highlights. So first of all is an integrated systems approach. When working with clients, occupational therapists use a very client-centered approach. I'm sure if you've done any research on OT or have had the opportunity to do some observation, you've heard this or seen this. And as such, it's really important that we understand that clients are embedded within larger systems. So we need to not only understand the client, but understand their families, understand the communities that they live in, understand policies and social systems that are impacting their occupational performance. So we're very much going to be utilizing the systems approach as we move through our curriculum, and students learn about mental health and adult populations, older adult, pediatrics, and the various practice settings that we serve those individuals in. There's going to be a really strong grounding in mental health and psychosocial practice. So we are actually kicking off our curriculum in trimester 1 with our psychosocial coursework. It's often the case in many programs that you start out with more physical disabilities, but we really find it important to start with mental health and psychosocial areas of practice. We believe that regardless of what type of setting you go into, not just if you go into a mental health setting, any setting that you go into, you're going to encounter psychosocial factors. We know that as individuals experience disease, injury, trauma, developmental disabilities, that there are psychosocial impacts. We want to ensure that our students are prepared to address those. As I mentioned, we're having fieldwork every trimester of didactics to provide that hands-on learning for our students, make sure they can translate what they've learned into practice, and matching the fieldwork context with what you're learning in that trimester. Another really unique attribute of our program is that we're having 2 full semesters of pediatrics. It's pretty common in a lot of OT programs to have a couple different trimesters of courses that relate to more adults or older adults, but oftentimes pediatrics gets sort of limited and minimized. And we know that pediatric practice is just as complex as working with adults and older adults. And just the types of settings that you work in when working with pediatric clients are really varied, and it's nearly impossible to teach it all in one trimester. So by having 2 full trimesters, it's going to allow our students to have a really deep foundational knowledge to enter any area of practice with pediatrics should they choose to do so. Our program will also emphasize program development and entrepreneurship with that goal of training practitioners who are able to go out and advance the profession and advocate for the role of OT in places that it doesn't currently exist. And to support that effort, we need to ensure that our students understand how to develop sustainable programs. And we want to encourage our students to be entrepreneurs. So that involves understanding the business aspect of practice. If you'd like to start your own business one day, or would like to develop a product, or would like to develop a program, through our course offerings and our elective opportunities, our students will be prepared to do so. Leads me right into the next bullet point, which is that our curriculum allows for students to take up to 4 electives. So there will certainly be elective courses related to advanced areas of OT practice, and this will be based on the expertise of our faculty. So just for example, if you were interested in hand therapy, there may be an elective about hand therapy. It'll be definitely touched upon in the core curriculum, but this would be an additional opportunity to advance your knowledge in that area. Or maybe it's with working in the NICU or in school-based practice. But like I mentioned, in addition to these OT-focused electives, we want to be ensuring that our students are prepared for a career in a wide range of settings. So offering business electives, entrepreneurship electives, in addition to the areas in our core curriculum where that's already addressed. As I mentioned, students will complete group research under the mentorship of a faculty member, and you will also receive strong guidance and mentorship for completion of your capstone. And capstone is one of the main distinguishing features of an OTD curriculum versus a master's in occupational therapy curriculum.
There is one question about the curriculum while you're there. It says, in regards to the didactic coursework, will any of those classes focus on practicing for the MBCOT exam?
As I'm sure you would expect, there will be multiple choice exams as part of the assignments in nearly every course of our program. And in developing those multiple choice exams, we will be writing those questions in the same fashion as MBCOT questions so that students get a lot of familiarity and practice with what those type of exam questions look like. In addition, in the 7th trimester of the program, we're going to have a course called Occupational Therapy Professional Transitions. And in that course, we are going to be doing some NBCOT review, develop strategies for studying for the exam, in addition to learning about like licensure and working on skills related to employment, like developing a resume and interviewing and whatnot. So yeah, there will be opportunities throughout, and then a very focused, concentrated course towards the end, close to graduation. Hope that answers that question.
Thank you.
All right, so next I'll talk about some distinguishing features of our program. I've touched on a couple of these. Others I want to get into in a little more depth. These are things that we feel just set our program apart from others in the area. And we really believe that it's important for students to find a program that is a good match for their professional goals and interests. And so we want to just be really transparent with what these features are so that you can make the decision that's best for you. So if things on these next couple of slides kind of excite you and pique your interest, that's an indicator that KGI might be a great home for you. The first on here is engineering and design collaborations. As I mentioned, KGI has a medical device engineering program, and we're certainly going to emphasize or have opportunities for interprofessional education throughout our curriculum, but we're going to have a whole course called Assistive Technology and Innovations. And in this course, we are going to pair OT students with medical device engineering students to develop devices and technologies for clients to promote their independence and function. Because oftentimes as OTs, we have like really great ideas for tools to help our clients. We don't always necessarily know how to make those things. And then engineering students have those skills to make them, but they would benefit from collaboration with an OT to understand unique client characteristics and ensure that what they're developing really meets the user's needs. So we're excited about that opportunity for collaboration. The next one you see on there is lifestyle medicine, which I touched on earlier. It's one of our curricular threads. Lifestyle medicine is a multidisciplinary, evidence-based approach to healthcare that really focuses on health promotion, as well as prevention, reduction, and reversal of chronic conditions. So if you're not aware, it's sort of the state of our healthcare system in the US to be more reactionary. We prescribe treatments or medications once a person already presents with a chronic condition. Lifestyle medicine is really about using lifestyle interventions to promote health and well-being in the hopes of preventing those chronic conditions from ever happening. But if a person does have a chronic condition, giving them the tools and skills to develop healthy habits and routines to reduce or reverse the impact of those chronic conditions. We believe that utilizing this approach is really going to change the way healthcare looks in a positive direction. And a lot of medical programs are training their students in the use of this approach. And they need therapists who can actually deliver these lifestyle interventions. And we see the pillars of lifestyle medicine aligning really well with what we do as OTs. We know as occupational therapists, we are well trained to understand how a person's environment impacts their lifestyle choices. And we are trained in understanding how to help people establish these healthy habits and routines. So lifestyle medicine looks at things like one's physical activity, their stress resilience, their social connections, their nutrition, their sleep. All of these lifestyle factors play into health and well-being. And we are going to be integrating this throughout our entire curriculum so students understand how to apply lifestyle medicine interventions regardless of the age of the client they're working with or the practice setting they're working in. So there will be, in the first trimester, there's going to be a lifestyle, health equity, and occupational justice class that will introduce some of these basic core concepts of lifestyle medicine. But we feel it's really important that we not just look at lifestyle medicine, but we also look at health equities and health disparities that exist that might impact somebody's ability to make positive lifestyle choices. Not everyone has access to nutritional food or safe neighborhoods to do physical activity, and that can cause some issues with their occupational performance. So what we need to ensure in the very first trimester that our students have an understanding in those areas. And then throughout every other trimester, as you learn about adults, older adults, children, you'll be learning how to utilize lifestyle medicine techniques in your practice. And then in the fifth final didactic trimester, there will be a lifestyle medicine course and a partnering lifestyle medicine level 1 fieldwork, where you'll be able to go out over the course of about 7 to 8 weeks to sites in the community and implement lifestyle medicine interventions. So we're really excited about that. Innovative clinical skills. I feel like I've touched on this already. All the innovation, again, just ensuring that our students are being introduced and trained in the most current and cutting edge approaches, lifestyle medicine being one of them. The last one you see on there is community-based practice. While our program will certainly prepare students to go into traditional settings, we really believe that there is an opportunity for OT to increase its presence and advocate for its distinct role within community-based settings as well. And in order to do that, we need to give community-based practice just as much time in our program as preparing students with skills for more traditional settings. So again, this kind of goes back to that program development and entrepreneurship focus of our program. Students will be trained in the skills to understand the needs of communities, develop evidence-based programming for those communities, identify funding sources to support OTs in those communities, and really just prepare our students to advance the profession in this way. We want to see OTs everywhere. Next is diversity, equity, and inclusion. There's a couple different aspects of this distinguishing feature. One is at the curriculum level, and that's tied to that course that I just shared in the first trimester that's looking at lifestyle equity and occupational justice, and just understanding how these are factors that must be considered in every population and practice setting you work in. In addition, we believe it is incredibly important to diversify the field of occupational therapy. If you've ever looked at statistics or just looked around, You know that OT, like many other healthcare professions, is not diverse. Especially in OT, it's a lot of white females. And this is not representative of all of the communities and populations that we serve. So in order to increase diversity in the profession, we need to ensure we have more diverse student population. I'm going to be talking a little bit about our holistic admissions process in a bit, and we're hoping that that is a step in the right direction to bringing in more diverse students. This really just, it enriches the profession certainly and allows us to address the needs of various communities, but it also just enriches our classrooms, right? We want a diverse range of experiences and backgrounds contributing to classroom discussion. We want students to be able to challenge each other's perspectives. It'll just result in a really rich learning environment, and that's really important to us. In addition, we're going to do our best to ensure that faculty makeup is diverse as well. We know that we're not going to be able to have faculty that is representative of all of our students, and because of that, we are initiating a mentorship program, not only for the OT program, but KGI-wide, that will identify mentors, whether it's faculty members at KGI or clinicians that we identify in the community that can serve as mentors for our students, people who have been through similar lived experiences. Perhaps you are a single parent pursuing an occupational therapy career. It'd be really helpful to have a mentor that you can connect with to offer support throughout grad school, or if you're a first generation college student, or if you're returning to OT as your second career. We understand that students are more successful when they feel that they have mentors or faculty members that they can connect with. So that's an initiative that we're working towards. OT and higher education is the next one on the list. As I mentioned earlier, we think that there is opportunity for OT just about everywhere, and higher education is one of those areas. You all know, if you've been through undergrad, perhaps some of you have maybe even done a graduate program already, you'll certainly learn if you go to OT school, it can be a time of high stress. And a lot of these lifestyle factors, like students' physical activity and their sleep and their stress, is really impacted. There's also certain skills related to the role of being a student, such as time management, study habits, organization, that will really impact their success. And OT can address all of these areas. So in the last year, KGI has had an OT doctoral resident from USC providing occupational therapy services to the students in KGI programs. So not OT students, we don't have any on campus, but to students in other programs. And they have been working under the Student Affairs Department and supporting the efforts of Student Affairs. And KGI saw so much value in this. The response from students was so positive. So we're working to establish a full-time occupational therapy position within the Student Affairs Department. This is beneficial for a couple different reasons. One, when our OT program starts, our students can get OT services to support their success if they need it. Second, this will provide fieldwork and capstone opportunities. So if you are interested in becoming an OT at our higher education institution, you will have some fieldwork and capstone experience to support you in that goal. So it's really exciting. The next one on there is whole person care. I feel like I've touched on this already, but again, just our emphasis on understanding that you're not working with the entire client, but that there's multiple systems to look at as we think about what's influencing a person's occupational engagement. Last one on there is trusted partnerships. We know that fieldwork and capstone are really critical pieces of OT education and in preparing our students for practice. And you may have heard that there have been some challenges with fieldwork in recent years, just because of the number of students and number of programs. And so we are really thoughtfully and intentionally going about developing trusted partnerships with sites in the community that are like-minded, that share similar missions and goals as we do for our OT students. So we are being mindful of who we are selecting to partner with and ensuring that it is a very mutually beneficial relationship. This is not going to be the sort of thing where we are frantically calling all of our fieldwork sites once a year to ask them to take one of our students, but rather these are going to be sites that we are continually engaged with, asking their therapists to come do guest lectures in our program, collaborating with them for those research projects, going to do observations in their clinic for various class assignments, in addition to doing fieldwork and capstone. And we want to give back to those sites to show our appreciation and to really foster the type of relationships we're looking for. So we're going to be providing supports through continuing education training for our fieldwork educators and capstone mentors, and access to the Claremont College's libraries, which will support them in their professional practice and support them as they support you. So really being very intentional with developing our relationships for fieldwork and capstone for our students. All right, so here's the breakdown of fieldwork and capstone. Like I mentioned, the level 1 fieldworks correspond with what students are learning in class. So because the first trimester has a psychosocial focus, that's going to be a more community-based fieldwork experience. That will be 40 hours. It's going to be broken up over the course of the whole trimester, well, of about half of the trimester. We're going to have students go out to sites in the community. Some may have OT. Some of these sites are going to be places that don't have OT. You're really going to be looking at what is the role or what could be the role of OT in this setting, and what are psychosocial factors that are impacting the clients or community at this setting. In trimester 2, you'll be learning about adult and older adult populations. So you will be going to a site for 40 hours. It's 1 week, 40 hours at the end of the trimester. This could be a hospital, an outpatient clinic, a skilled nursing facility, to start to get some hands-on opportunity and some observation opportunities. In the 3rd trimester, you're in your second portion of learning about adults and older adults. For this one, it's going to be 40 hours, 1 week, but it's actually going to be through simulated learning on campus. We have access to a patient simulation center, standardized patients, and some really cool simulation case studies and technologies to support learning. The reason that we're doing this is to ensure that our students have equitable fieldwork experiences. We know that sometimes students go to a site for level 1 fieldwork and they get to do a lot of cool hands-on stuff, and then some other students don't necessarily get as much opportunity for that. So by doing a on-campus level 1 fieldwork, we ensure that all the students are working through the exact same cases and getting the same feedback, and it just really equals the playing field. I just noticed a typo here on this slide, so I'll point this out. In trimester 4, you have a pediatric rotation. That's going to be the same thing, simulated on campus, working through simulated cases. And then in trimester 5, not only are you going to have that lifestyle medicine level 1 fieldwork I mentioned a little while ago, but you're going to have a second pediatric level 1 fieldwork where you're going out to a pediatric site for 40 hours at the end of the trimester to understand what practice looks like in those pediatric settings. Then in trimester 6, you'll do the 12-week full-time level 2 fieldwork rotation. That'll be followed by the second one in trimester 7, and then you'll move into your doctoral capstone experience in the final trimester, which is 14 weeks full-time. Any questions coming up in the chat, Lexie?
Nope, not right now.
Okay, great. All right, so let me touch a little bit on our program admissions. As I mentioned earlier, we are using a holistic admissions process. Again, this really relates to our emphasis on diversity, equity, and inclusion. We know that GPAs and GRE scores do not necessarily mean someone is a great fit for the occupational therapy profession. And in fact, we know that requiring an expensive test like the GRE can be a barrier for a lot of people in thinking about going to graduate school. We want to reduce those barriers, again, to offer as much equitable access to our program as possible. So while we do have a GRE requirement, we're not requiring the GRE. We are going to have students do a personal statement so we can get to know them a little bit better. We will be doing interviews so that you can get to know us and we can get to know you. We're going to be looking at a variety of factors that we believe are indicative of a great OT. So looking at your volunteer experience, looking at observation time that you've been able to get, looking at any leadership you've done. Maybe you've been a caregiver for someone in your family. There are all sorts of past experiences that can contribute to you being an excellent OT, and we want to be able to consider all of those different factors. In addition, in our application, we'll be offering an opportunity for students to share with us, if they'd like to, what we're calling unique qualifications. So maybe your GPA wasn't the highest in undergrad, but perhaps it was because you were a single parent or a first-generation college student or experienced illness for yourself or in your family during that time. We know that there are a lot of different life experiences that can impact someone's grades. Doesn't necessarily mean they should be ruled out from our program or the profession. So there's an opportunity on our application to share some of those unique qualifiers so that we can really holistically look at your application and find the best fit for our program. International students are welcome to apply with the TOEFL exam, and much like nearly all OT programs, our application is available through the OT CAS system, and it's available now. Here's our admission requirements. These are listed on our website as well. You do need human anatomy and physiology, human lifespan development or developmental psychology, abnormal psychology, introduction to sociology or cultural anthropology, statistics, and medical terminology. These foundational prerequisites will make sure that you have a basic knowledge that will set you up for success in our program. In addition, we'll need official transcripts verifying that you've completed your bachelor degree, 3 letters of recommendation, and we recommend observation in occupational therapy settings. However, we know that there is limited access in normal times, but definitely during the pandemic. So we're not having a required number of hours. Again, this is where that holistic admissions process is really taking a look at the entirety of our applicants and not just on GPA or number of hours. Here's a visual of our admissions timeline. So our application became available in OT CAS in July of this year. We are going to be conducting our applicant interviews in February through April of next year. Then we plan to notify our applicants around May of next year. The first cohort will then start in August. That's our timeline.
There is one question about the application process. Is there a supplemental application that is required?
Supplemental, I don't know exactly how it's structured in OT CAS. I know that we, in addition to the personal statement, we requested to add in those sections for students to provide those unique qualifiers, but I don't know if that's actually considered a supplemental application. It's just whatever appears for you in OT CAS. I don't know if Lexie, you have any more information on that.
Sure. Yeah, I think, from my perspective, I'm not sure because I haven't done a test application, but I think it will come up as a supplemental question. So you'll see that KGI requires a supplemental application, and then it will ask those questions. However, we are not charging a fee for that, and some schools will charge a supplemental fee. So I don't believe there'll be a fee, but there will be a separate, at least like section to fill out those questions.
Thank you.
Yeah, I think that. But if I find out any other information, I'll email everybody that's here on the webinar today.
Thank you.
I have a quick question. Sorry, I don't know if I just misheard you. So I filled out my application through OTCAS. Does it mean that there's a secondary application, or is it just the OTCAS application?
Just the OTCAS application.
Okay, thank you.
Yep.
So when you say that there's going to be a holistic approach and that we have an opportunity to put in our life experiences and things like that, is that on OTCAS?
Yes, yeah, we've built those questions into the OTCAS application.
Okay, and you said that it started already, but the deadline for the last day to turn it to submit an application is which day?
So we don't have a deadline. We're using rolling admissions right now. So you're welcome to apply at any time.
Okay.
All right, good questions. All right, lastly, just want to share a little bit about our accreditation process. As a newly developing program, this means that we are not yet fully accredited, and we recognize that this is a question that students have and a good question that students have. There are several steps to becoming accredited that we're moving through right now, and this is a very typical timeline for newly developing programs. First, we're submitting our candidacy application this December. We're in the thick of preparing that right now. ACOTE wants to ensure that we have the appropriate faculty members, that we need to turn in our curriculum. They want to see that we have these demonstrated partnerships with Fieldwork and Capstone sites. We'll hear back on that candidacy decision around April of next year, and then spend a couple years doing what's called a self-study, where we submit to ACOTE exactly how we're meeting all of their educational standards. There are roughly 60 related to just the educational curriculum portion. There's even more than that, just about our program makeup in general. Then we'll have evaluators from ACOTE, and that's our accrediting body, come to KGI to see our facilities and meet with our faculty and our students. And then we'll get an accreditation decision before graduation. This says March of 2025, and we've been given feedback that it will likely be even sooner than that. So roughly 4 to 5 months before students graduate from the program. Like I said, this is very typical if you're exploring any other new programs in California or outside of California, they will follow a similar timeline. We want to instill confidence in students who are coming into our program. Our program director has over 20 years in OT education, has been through accreditation at multiple institutions. I myself and our academic fieldwork coordinator have both been through accreditation at previous institutions. We have immense institutional support from KGI for developing this program. So we are feeling extremely confident about our accreditation process. But we understand, we get it, that it's a question for students. Lastly, here's some information about our accrediting bodies. So ACOTE, the acronym you saw on the last slide, stands for the Accreditation Council for Occupational Therapy Education. They accredit all OT programs in the country. And then KGI is accredited by the Western Association of Schools and Colleges, and we are in the thick of finishing all the requirements for that right now too. There's more information about all of this on the website if you haven't taken a look already.
We've had a couple more questions come in. So I have 3. The first is there a specific breakdown? I'm so sorry, there's a siren. Is there a breakdown on who the letters of recommendation should come from? For example, should they come from occupational therapists, from professors? If you can talk a little bit about that.
We don't, to my knowledge, and I can double check on this too, I apologize for not being 100% confident in my answer. I do not believe we have a requirement that this many need to come from an OT, this many need to come from a professor. What I would recommend is asking people who know you well and can speak to who you are as a person well. If we get a letter of recommendation that's 4 sentences, that's Joe is a great student, that really doesn't give us a sense of who you are. So I would prioritize people who have an understanding of your character, who understand who you are as a student or someone with aspirational goals to pursue higher ed. That would be what I would recommend.
That is what the website says too. So
great,
you got it. The second question is there a certain way or format that students should record and submit their observation hours?
Good question 2. I was thinking that there was a spot on OT Cast where you record it. I'm seeing one shaking of the head.
They do show one on there. I also uploaded a copy of my where I did my hours was at Pomona Valley Hospital, and I just asked the volunteer program, and they gave me a whole timesheet. So it shows you the total number of hours and all of the stuff I've done. But you also insert it on OTCast, and you can specify you spent this many hours doing pediatrics, this many hours doing this many hours doing, emergency, just things like that. And then at the bottom, it says total number of hours.
Great. Yeah, but there's no form that they require you to use, right? It's just they have a spot on the OTCast where you can input that information and then upload any supporting documentation.
Yeah.
Right.
I just downloaded, yeah, because they have that optional area where you can like put in the document for or volunteer hours, and then they have that other section too. So you don't even have to have actual documentation.
Yeah.
You just have to fill it in.
Okay, that's what I thought. Thank you for verifying.
I have a question about that actually. I was looking to also volunteer with Pomona Valley Hospital in their pediatric OT program, but they had said that you need a certain amount of hours, and if you don't complete the hours, they won't even sign off on anything, and they won't give you a letter of rec. And I have a full-time job, so it was a struggle for me. But if they're not even going to sign off on the hours, even if you've done say 50 hours, how, like, can you document it yourself, or how does that work?
Because OTCAS doesn't require a form that's signed by anyone, I would say still put in those hours that you've completed. Okay. Certainly want like that has enriched your understanding about occupational therapy undoubtedly, and provided you with some useful insights. You should certainly be able to share that with us. But of course, it sounds like that's maybe not the great match for you to continue doing observation hours, and it might be a good idea to look for other opportunities. I do want to share too, and I think I see some people here who perhaps participated in this past summer. Depending on when you are planning to apply to our program, in the summers, we offer a pre-occupational therapy program at KGI. The last 2 summers, it's been fully online. Next summer, our plan is to do one session online and 1 session in person at KGI, assuming that we're able, I'm hoping we'll be able to do that. And this is just an opportunity for you to hear from different occupational therapy voices. We ask people from different backgrounds and different practice settings to come and share with our students about sort of like what a day in the life looks like, do some occupational therapy activities, some active learning to kind of get you learning a little bit more about OT process and intervention. So that's another opportunity that we offer. That's a free program. There is an application process, and I don't think, Lexie, you may know more about this. I don't think we have the application open for next summer yet, but keep your eyes on the website.
It is open now, so you can.
It is cool. Yes. Good to know.
Yes. And I've pasted a bunch in the chat. Sorry for so much information, but there's some links there as well for anyone who doesn't want to read through. A link to our tuition page. I also pasted the tuition in. A link to the pre-OT program page. And then from that page, you can get to the application as well. Just note that it is a separate application. So you'll apply on OTCAS for the OTD program, and then you apply on KGI's internal application for pre-OT. And for the tuition, I know one of the questions was whether we provide financial assistance. We do provide federal financial aid and some merit scholarships and need-based aid as well. So that'll be developing throughout the year, since this is the first cohort we'll have for the program. Scholarships are still, being actually secured at the moment, but we do have, most of our students actually do receive financial assistance. And then the one other question that I want to check and make sure I don't want to answer it incorrectly is whether you will be reviewing applications on a rolling basis, or whether you'll wait until I think January to start reviewing.
Doing applications quite yet. We will wait to do that until closer to our interview time. I also saw a question in the chat box about are you going to wait until May to alert everyone? We actually cannot alert students until we've received our candidacy status, and that won't be happening until around next May. So that's why we're timing those interviews for mid to late spring, and then we can let people know as soon as we get our candidacy status in May. But we will be doing, over the course of a couple months, reviewing applications and doing interviews.
There's a question also about fieldwork. For level 2 fieldwork, are they allowed to go outside of California?
So right now we're really focusing our efforts on California. There is a agreement that's too complex and lengthy to discuss in detail for the purpose of this particular presentation this evening, but California does not have an agreement with every state to send our students to other states. However, there is opportunity to examine case-by-case requests. So if you are not from California and you prefer to do level 2 field work where, whatever state you're from, we could have a discussion about that and see if we could request special permission to send a student outside of the state. But right now we are focusing our efforts on building up partnerships in California. We're also exploring opportunities for international fieldwork. We don't have anything set up or finalized yet, but those are goals that we're working towards to provide our students with more opportunities.
There is a question as well. This might actually be for others in the group. That is for those folks who work full time. Are there any suggestions on how to gain hours experience?
And I saw someone below that share an idea about virtual shadowing options.
The only thing with that is, I found, I think one, but then there's no OT to write you a letter of recommendation. So I'm struggling with that. And I've only found one. If somebody has another idea of virtual hours, that would be great.
I know.
Go ahead.
Oh, some folks, I think that's why they were excited about our pre-OT program. It gives it, although it's not direct, patient hours and shadowing an occupational therapist, you are gaining some experience and exposure through that way, and possibly gaining a network of folks that you could connect with and learn about some other opportunities. So I would suggest looking into the pre-OT program and seeing if you can make that a possibility.
And in terms of letters of recommendation, consider your current employer. If you feel like they know you well and can speak to who you are as an individual and a worker, just because they're not an OT doesn't mean that you shouldn't request a letter of recommendation from them. These are people who I assume know you well and have worked closely with you, so they could potentially write one as well.
I just started my job 4 weeks ago.
Oh, okay. All right. Well, maybe in a couple of weeks, maybe in a month or so, they'll know you even better. But think about past jobs, past professors, past volunteer opportunities. Yeah, because I understand that working full-time does limit the flexibility you have for observation.
There was a question about the application too, and I want to make sure I clear this up. I think I was a little confusing. So the OTD program, if that's all you're applying to, you just apply through OTCAS, that's all you have to do. No worries about an extra application. If you'd like to apply to the pre-OT program, that would be the only instance in which you would need to apply on a separate application, and that's on the KGI website. So for OTD, just one app, nothing else required. And then pre-OT is totally separate. And pre-OT, again, is our summer program. It's a short-term summer program to gain experience and knowledge about the OT profession and field.
I like the creative solution shared by Megan. And you're absolutely right. There are still a lot of OTs delivering services via telehealth, and that might allow for some more flexibility if you are shadowing someone in a different time zone potentially. I like this creative problem solving. That's what we're all about here.
Very good potential OTs in this crowd.
I know, yeah. So I like to see.
There was another question about break time, which I could look into this if you're not aware, but do you know how long the summer breaks and other breaks between trimesters are? Does it allow folks time to travel and do other things?
So there is no long traditional summer break, because like I said, we're running on a trimester schedule, but there usually is about 2 weeks, and I'm sure we could get a copy of the academic calendar, but there usually is about 2 to 3 weeks in between trimesters that would allow for students to travel, spend time with family, do whatever you got to do to refresh and relax before the next trimester starts. Which we very much promote and encourage for occupational balance and well-being. Any other questions about our program?
I would be very excited if there was an international fieldwork option, just as a note.
Oh, so would we. We are on the same page about that. Okay, question about, is it possible to be a full-time student while also working a part-time job? So we certainly can't tell students not to work. We fully understand that people have responsibilities and various life factors that influence their financial situation. I will say that being a doctorate student is intense. It's a lot of work and dedication and commitment. So I think it really depends on each individual person and what their threshold is for managing the stress and the demands, and just kind of what works for them. In general, most students don't work during this time. I know you're seeing those tuition numbers and it kind of makes your eyes go wide looking at them. But I'd like to ensure you that you are entering into a profession with excellent job outlook. And I think that a program like ours that is really pushing the boundaries of OT and creating even more opportunities for OT is only contributing to that outlook. Okay, let's see, another question. For the level 1 fieldwork with lifestyle medicine and in-person pediatrics, is it 40 hours combined or 40 each? It's 40 each. So lifestyle medicine level 1 fieldwork will happen in conjunction with your lifestyle medicine class. So you'll spend, I think it's, I can't remember the exact hour breakdown, but you spend a couple of hours per week, and we will make time for that in your schedule to go to a site and do lifestyle medicine groups with individuals. And then at the very end, the last week of the trimester, you'll do a full 40 hours at a pediatric site.
With there being an extra variant, I was just wondering if KGI has any plan put in place if we do see cases start to rise, if there's any like adaptations that will be to classes, like will it be hybrid, or if you know.
Yeah, I mean, it's so hard to know what next fall will look like, right? KGI, along with many other OT programs and academic institutions, were really successful in translating their in-person classes to an online learning environment. We've been able to meet the same outcomes at KGI that we always meet, and even then some. So I'm confident, and as OTs, right, we are creative problem solvers. So if something happened where we had to go to a hybrid model or fully online, we would adapt quickly to do so. We are on campus right now at KGI. Students are back on campus. We have strong COVID safety guidelines, and we have technology in place so that students can attend class virtually if needed, if they've been exposed or aren't feeling well. We also have technological support for faculty to provide class remotely if they themselves are not feeling well or have been exposed. So safety is number one importance, but I also, historically now we have evidence that we're able to successfully deliver online as well. I was at another OT program during much of the pandemic, and we did what we needed to do to make sure that students were getting a quality education and were coming out with a skill set that they needed to be successful in practice.
Thank you.
Looks like one more question came in, and I don't want to miss it because I think it's a common question about accreditation and whether that impacts graduates' ability to become licensed.
Yeah. So in a worst case scenario that I do not predict happening for us at all, if the program wasn't accredited by the time you graduate, you would not be able to sit for your NBCOT, your national board certification, and you must pass your national board certification to get licensed to work. So there would be a trickle effect that would impact your ability to work. That would only happen if we didn't get accredited. And like I mentioned earlier, I strongly believe that we will get fully accredited prior to your graduation. But that's a good question to ask. Again, we know that, I think the best word, I can't think of another word. We know that students are taking a risk on applying to a non-accredited program. We fully recognize that, and that's why we were wanting to make sure we're doing everything in our power for students to feel confident and to trust that we will get this over the finish line for you.
If it makes people feel any better, I noticed that a lot of the OT schools right now are all transitioning anyway. So everybody's pretty much in the accreditation process because they're all transitioning to doctorate. Because I was just looking through, and Loma Linda's also changing, and so is USC. So it's almost every school. So I mean, I shouldn't scare you off to try to apply. So
that's a really good point, Ashley. There are some established accredited OTD programs in the nation. There's some in California. But like Ashley mentioned, there's more and more OTD programs opening, master's programs transitioning to OTD, and just brand new OTD programs. So you're likely to run into this if you're applying to other schools too.
And it might interest you all to know that we have had 2 other programs go through full accreditation in recent years. We have a MS in genetic counseling program and also a PharmD program that have both had to receive program-specific accreditation, and we had no issues with that. And while the OT program is going through accreditation, so is our PA program. So it's something KGI is very familiar with and has a lot of knowledge about how to do that well. So you're in good hands.
A question about like if that did happen, would you be able to transfer? I honestly don't know the specifics of that. I just want you to be able to trust that that won't happen. And then I saw one, maybe we can end on this one. I just want to be respectful of everyone's time. I can hang out for a few minutes more, but if others need to hop off. If our candidacy accreditation status occurred, I want to clarify that it would be our candidacy status with accreditation occurs before May. Would we start accepting earlier? Yes, I imagine we would. As soon as we are able to notify students, we will do so people can make decisions and plan for their life. We are very excited to meet our students, so we want to let you know as soon as possible. Right. And just want to be respectful of people's time. I so appreciate you coming this evening to hear more about our program. I hope that as I've been sharing some of this, that it's helped you gain some more perspective about whether this program would be the right fit for you. I certainly hope to see some of your names and faces on applications and interviews, and feel free to email Lexie. I'll also put my email address in the chat box if some question that's kind of more like program specific, less admission specific, but more like OT or program specific comes to mind for you later on. All right, well, I hope everyone has a great rest of the day. Thank you.
Thank you.
Thank you.
Can we stay on and ask you questions if possible?
Lexie, if you need to go and you want to make me co-host, I don't know if that's an option. I just want to be
okay. I can hang out for a minute
Okay.
too. I did want to. I'm glad you stayed on, Sarah. I saw your question come in right after we finished. So she had a question about if you have any information on like average salaries or starting salaries for OTs in California.
It's I guess that's not accessible. Okay, so there is a workforce survey, an OT workforce survey that's conducted by the American Occupational Therapy Association. And it was conducted, it's conducted every few years. So the data is from like 2 or so years ago now, but it tells you average salary by demographic area. It tells you average salary based on practice setting, based on education level. You do have to be a member of AOTA to access, though, I believe. So if you would like to give me your email address, I'd be happy to send you that information.
Should I just send it in the chat?
Yeah, that'd be great.
And the other question I had was about how many people have applied so far for the program?
Do you know, Lexie? I have no clue.
I think like maybe around 300 or so started apps, but I will give
Started
you
apps.
the
Oh, okay.
caveat. Yes, started apps. Not everybody finishes. That's because I don't know if you've gotten into OT CAS yet, but you can kind of like in a CAS application, check all the schools you want to apply to. And so there are some people who apply to every single school in California, or just like as many as they can, and then they don't actually end up submitting. So so far, I don't know how many submitted we have. We just have like around 300 started.
I'm one of
Well-
the 300, but I'm gonna finish it.
Finish it.
I think I'm
And-
just gonna apply for this program and maybe another one, but I live in Claremont, so it's walking distance.
That'd be amazing.
Yeah, that'd be so great.
This is the first like orientation where I felt like excited about it and where I felt like I could really fit in. The other ones felt more like less personal, I guess.
I'm glad that was your experience tonight.
Thank you.
All right, I wrote down your email address, so I'll send you that information.
Okay, thank you, and have a good rest of your.
Great to meet you, Sarah.
Nice to meet you too.
Is there anyone else?
Meryl or Alyssa?
Hi. Hi, I'm Alyssa. I had a quick question for you. So I'm working on my application right now, and I was on academic probation at one of the universities, and I'm not sure how to go about it in terms of explaining what happened. So like they have like a section where you could kind of explain it, but it's only 500 characters, which is basically like 2 or 3, like a couple sentences. And so I was wondering, would you suggest maybe like, should I include that in maybe my personal statement? Like how, I guess what had happened there. Well, it helped me grow as a person when, because I had to do with my mental health. And so I'm wondering, would including that in my personal statement, would that be okay to do?
I don't think there's like a right or wrong like answer here one way or another.
Mhm.
I do think that if you're going to write about it in your personal statement, I would definitely focus on what you just said, like how did you grow from the experience and why do you think it will make you a great student, a great OT? Those are examples of like the type of life experiences we want to hear about. So
Okay.
if you feel like you can't fit that into the section where you can share an explanation or talk about those kind of unique experiences, then you certainly could consider putting it into the personal statement.
Okay, yeah. Just well, because I think on my transcript you could see, like I had a I think it was a 2.45 when I was there, and now I have a 3.86. So like you can see it on my transcript. So would it be okay to like just reference that? Like I guess like how much better I did after I transferred and then I transferred again, and so just like kind of talking about like my journey from like that experience to where I am now.
Yeah, I mean, the personal statement is an opportunity for you to share about yourself. So it sounds like this is an important part of your journey to get to this
Mhm.
point. So I would definitely, think about how you can write about that in your personal statement so we can get to know you.
Okay, and then I saw that you guys said that one of the focuses was on mental health for the OTD program, right? Okay, yeah, because like that's kind of like what I've been, well, because of that experience, I feel like that's something that I'm really interested in focusing on in terms
Yeah.
of like a career. So I was gonna put that in there as well.
Yeah.
Okay.
We have a full mental health focused trimester. Like I mentioned, that's our very first trimester is mental health focused. So from a curricular standpoint, there's an emphasis on mental health, but also we are very much a proponent of supporting the mental health of our students. Like we know grad school is challenging and hard and stressful.
Yeah.
And so that's why we love that there's been OT services available. Being a part of the Claremont colleges means that students have access to the Claremont colleges resources, including student health services, mental health services. So we want to ensure that our students have all the necessary supports and resources to be successful while they're in the program.
Okay, yeah, sounds good. I just wasn't sure like how I would be able to explain like my grades at that time. I just didn't want it to reflect too poorly.
But I mean, Alyssa, this is exactly why we are doing holistic admissions. We do not want a number on a paper to
Yeah.
exclude someone from being in our program. So we appreciate you sharing your journey.
Okay. Alrighty. Sounds
All
good.
right.
Thank you
All
guys
right.
so much.
You're welcome.
Thank you.
Bye-bye.
Great to meet you.
Oh, sorry. Nice to meet you too.
That's
Bye.
okay.
Have a good night.
Bye. Thanks so much.
Hey,
That was
yeah.
great.
I'm like, now I need to look at OTCAS again. I know we met with Jason about it like a couple months ago now and talked about what it all would look like, but I haven't
Yeah.
like seen it from like the student's end. So I'm like,
Yeah.
what does, where does it say that? What do you have to upload? I don't know.
Yeah, I know. I think Jason can see it from the student side. So
Yeah.
I would be curious to see what the KGI portion looks like.
Yeah.
I'm not totally sure. So maybe we can find that out. I'll make a note to ask him about it and see if he can give us like a screenshot or something.
Awesome. Okay,
Yeah,
well,
but I
thank you
think
so
that's great.
much.
Yeah, sorry I was running so late. I
That's
emailed
okay.
Christy and totally forgot that you were doing tonight. So
No, that's okay. I was like, I'm pretty sure she said she was like
Yeah.
fine to get going, but I didn't know if you had any like opening thing you had
No,
or
no.
whatnot. So yeah.
No, everything went great. Thank you so much.
All right. Have a good night.
You too.
Bye-bye.
Bye.